Um, Today, let us study the anatomy of the temporal bone. We know that this temporal bone houses an important organ of hearing and balance, and anatomy of that is very, very important for otology surgeons, skull-based surgeons, and even neurosurgeons. This bone, which is placed on either side, has a combination of 5 parts. The part occupying this area is the squamous part of the temporal bone. The part which is behind this portion is called as mastoid part of the temporal bone. The part which is bounding the external auditory canal, forming its anterior floor and part of the posterior wall, this part of the bone is called as tympanic part of the temporal bone. And a small slender bony projection coming down is called as styloid part of the temporal bone. And the part which is forming part of the middle cranial fossa, boundary between middle and posterior, this portion is the petrous part. All this is petrous part of the temporal bone. So these are the 5 parts of the temporal bone. Squamous, that includes the root of the zygoma, articular fossa for the head of the mandible. And then the mastoid part is this, tympanic part is this, styloid part is this, and the petrous part is this bone which forms the boundary between anterior, middle and posterior cranial fossa.